Good afternoon. I'm George Latimer, Westchester County Executive, and this is Thursday, May 13th, and our second time this week where we'll be giving you the Westchester coronavirus update. I'm joined by Deputy County Executive Ken Jenkins. We try twice a week to give you an idea of what the extent of the infection and our response to the infection is here in Westchester County. And as we continue to do this twice a week, we want to give you an idea just as the week begins and just as we head toward the weekend exactly where we stand. The numbers have continued to be good now over an extended period of time. The New York State tracker is up as of today, reporting Thursday information, and it shows that on the basis of a totality of 128,703 positive cases pandemic to date, meaning over the last 15 months, we currently have 1,182 active cases of coronavirus. 1,182. That number is about 170 less than when we last reported to you on Monday. And if we look at, as I generally do over the past weeks, a week ago today, that number was 1,742, so that's a drop of 600 in a week. 2 weeks ago, the number was 2,640, drop of 1,500 in 2 weeks. And if we go back 3 weeks ago till late April, we had 3,714 active cases. So the number is continuing to drop at 1,182. Now, the drops have been much smaller because the number of active cases left is a very small number. So the percentages are such that while there's a continued diminution, it is not as great a numerical diminution as was when we had higher numbers from which to drop down from. But we're very encouraged by this. Overnight, we had 79 cases of coronavirus tested positive out of 8,076 tests. So you can do the math yourself. You see it's a very small percentage now that are testing positive. We've now gone a number of weeks where we have less than 100 cases in a given night. That's encouraging. And then, of course, through the 2-week cohort, people rotate off of active status because if they haven't been affected after 2 weeks, then they have beaten the disease through their own antibodies. Of that number, the last numbers that we have for hospitalizations, 76 individuals are hospitalized for coronavirus. That number the week before was 114, so that's a helpful drop from 114 down to 76. And if you go back 2 weeks, that number was 138, so almost a halving of the number over the last 2 weeks. And the hospitalization number shows the depth of infection. That number is a subset of the total number of active cases. So if we're at a point where the active cases drop a little by a little bit, but the hospitalizations drop dramatically, that may be a sign that the vaccination is not only reducing the number of people that get the disease, but more importantly, reducing the severity of the disease. Because the greatest fear we have is that people will be sick and then they will die. And that death figure, which is the next one I'm going to share with you, is the ultimate goal that we're trying to reduce to zero. Over the last week, we've had some great success. We've had the lowest fatality rate for a week as we've had in literally months. 4 individuals have deceased in the last 7 days. It's still 4 more than we'd like to have, but we had a number of nights of 0 deaths, and we hope that we're going to be able to put 7 of them together so that a week from today I can tell you that no one has died of coronavirus in the last week. That is an aspiration that we hope will be the case. But where we are today, those numbers have continued to drop, and we're encouraged, and we see no reason why they shouldn't drop further because the vaccination rate just continues to jump up. We have had in our 4 major vaccination centers a total of 367,265 vaccinations given. The county center, of course, open since January, 7 days a week, 11 hours a day, 253,000 vaccinations administered, and by all accounts we're told that the system there is working very smoothly. This and the other places as well, people get in and get out with a minimum of difficulty. The Armory, Yonkers Armory, which is operated by FEMA with the assistance of the state, 62,000 vaccinations given out. They've been open not quite 2 months yet. And our 2 clinics, one of which opened up in White Plains also in January, the other at the Community College Gymnasium opened a little bit later than that, an aggregate of 52,000 in rounded numbers, 52,000 vaccinations given out. So altogether, from those locations, 367,000 vaccinations. Then you add the pharmacies, you add the satellite pop-up vaccination areas, and a host of other things. And the numbers in Westchester are jumping up pretty dramatically. We have 442,781 Westchester residents who have been fully vaccinated, completed the series, and cleared the 2-week number. 442,781 people completed with their vaccinations. That's a very encouraging number. That number is significant, and it's even more significant that 533,000 people have gotten at least one vaccine dose of the two vaccine situations. So that puts us at 55% of those who have at least one vaccine dose. And of course, over the course of 3 to 4 weeks, those individuals get the second shot, and then our total number of vaccination jumps up to that higher number. Because until just this week, we've been unable to issue vaccinations to those under the age of 16. 20% of our population, all residents who are under the age of 16, have been ineligible to get a vaccination. And so that meant that the maximum number we could have would be 80%. And out of that number, that's going to change now, of all those 18 and older who are eligible for vaccination, 68, almost 69% have gotten at least one dose. So we're doing very well in the vaccination situation. And as will be reported in a second now, we're opening the door to vaccines to those who are under the age of 16, as it's just been authorized by the FDA that we could move in that direction. And that gives us the opportunity to add to the number vaccinated, the number of people who are less likely to get COVID, not impossible to get it, but less likely to get it, less likely to be severely affected by it, meaning hospitalization, and far less likely to be a fatality. So we're hopeful that all of those are good news. On the age front, it is true that now you can get a vaccine from the ages of 12 to 16. Only the Pfizer vaccine has been authorized for administering to 12, 13, 14, 15-year-olds up to the age of 16, which were already authorized. The county center provides the Pfizer vaccine, and they will accept walk-ins or appointments, but if you are under the age of 18, you must have parental or guardian agreement, consent. So that has to come. It's always a good idea if a parent or the guardian accompanies the person, and certainly if you're 12 or 13 years old, you're going to need to do that in order to get the vaccination in case anything might be a reality at the time you're there. But with that vaccination effort, you're going to see we're making some efforts now to reach out to young people to make sure they get vaccinated with the same energy that we've shown with other individuals at other age levels. This week, we conducted a couple of clinics at schools. We had one yesterday at Pelham High School, which was a combination of students and faculty from Pelham, Bronxville, Eastchester, and Tuckahoe school districts. We have one tomorrow at Westlake High School in the town of Mount Pleasant, and that will combine Mount Pleasant, Valhalla, and Pleasantville school students at that location. And again, we will give vaccines to adults, people who work in the schools anywhere, but we're targeting trying to get young people who are in school who are now eligible to receive those vaccinations. Ossining Volunteer Ambulance Corps has been doing vaccinations at Ossining High School to reach that particular contingent, and we're appreciative of that. And similarly, the Scarsdale Volunteer Ambulance Corps is doing the same thing at Scarsdale High School at their facility. So all of those things are very positive. As we look to next week, we have some additional vaccination locations set up. The Peekskill Family Resource Center at 400 South Division Street in Peekskill will be open on the 18th from 2 p.m. to 6 p.m. They have 100-plus doses and 4 vaccinators ready to vaccinate. The Dobbs Ferry School District will have vaccination on the 19th of May. That's going to be at the high school gym on 505 Broadway in Dobbs Ferry. They have 120 doses to administer. Fox Lane High School in the large gym. They're on South Bedford Road in Bedford, right off exit 4 of I-684. They'll be open from 2 to 6:30 on May 20th. Of course, that's a week from today, Thursday, and that is targeting Bedford Central and the Katona-Lewisboro school districts. So with every one of those school districts, we're making an aggressive outreach to young people who haven't been vaccinated. We've talked before about some of the different cohorts of individuals that have yet to be vaccinated. We've discussed it from the standpoint of vaccine hesitancy, and we have highlighted that young people who are already eligible for vaccinations, 18 to 29, are somewhat less likely to get the vaccination, slightly more male than female in that grouping. This is younger individuals under the age of 16 who haven't been eligible before. They're part of that 20% cohort of population that has not been vaccinated because they haven't been eligible to be vaccinated, and this is part of our outreach to those young people. Another one of our outreach is trying to reach people who are homebound, those who do not have the mobility to go out into the community at any location, even if it was down the street and across the blocks, to be vaccinated. So Ken is going to cover where we are with our homebound vaccination efforts. Ken.
Thanks, George. Certainly, the homebound vaccination program has continued to move forward. Westchester County's Department of Senior Programs and Services has announced additional availability of our COVID-19 program for those that are homebound. So any homebound individual of any age is eligible to receive the vaccine as long as you live in Westchester County. The caregivers for those homebound individuals are also eligible. So since the onset of the COVID-19 pandemic, our Department of Senior Programs and Services has helped get vaccinations into the arms of 3,000 homebound individuals across the county. And certainly it is a focus and a target to be able to get to those folks that are homebound, some of the people that are in our convalescent care facilities, and we've been targeting and utilizing the Johnson & Johnson vaccine to do that so that there can be one visit and be able to move forward. So if you are interested in that, you should be able to call today to 914-813-6300. That's the Department of Senior Programs and Services that can help assist you in creating those appointments for those individuals that are homebound. If you don't get someone, you certainly can leave a message. The team there, and they've been doing a fantastic job throughout the pandemic, will return your call and move forward. The Department of Health, in coordination with Empress Ambulance Service, have been doing those homebound vaccinations for all of us in Westchester County, and certainly want to make sure that to continue to tell people to utilize all the resources available to get vaccinated. As the county executive pointed out, at the local sites, at the school districts, make sure that you fill out those forms for the eligibility for the students in the school system. If you try to walk into these sites or any other homebound site, you need to make sure to have that eligibility form or the consent form signed by the parent or guardian. It's always better if the parent or guardian is there, but during the school day, that's probably not likely. So make sure you fill out those forms to be able to get those young folks vaccinated. And the homebound program, we thank everyone that continues to do that, to keep our numbers in the consistent good positions that the county executive has pointed out. Thanks a lot, George. Thanks, Ken.
Thanks very much, Ken. We're also going to highlight that at tonight's town hall meeting, and our Director of Communications, Catherine Chaffee, will be present to ask the questions for most of that period of time. We're going to have some young people, medical professional on, medical doctor, to be able to answer questions from young people about the disease and the vaccination situation, since we are now focused on both vaccinating those who are now under 16, because that is possible and allowable, and also because we know that we have to make an outreach effort to those young people. We have launched our I Kicked COVID to the Curb campaign. It's kind of fun. We have some graphics that go with it, some public service announcements that target communicating with people in an appropriate age cohort. It is important for us to try as best as we can to communicate with young people. We know that many of the traditional communication means that those of us as adults used are not necessarily how young people are going to get their information, but we're going to try to be as creative as we can. We've made connections with the New York Knicks that have already been reported. We think that athletes make a connection with some of the young people out there, and if the athlete that they imitate and want to be like is doing this, then it's a good thing for them to do as well. So we hope that'll be helpful. We know that we still have to maneuver and manage the kind of product we have. It's Pfizer that's available for young people. We're hearing that there is research going on Moderna. If and when that's authorized, we'll be able to do that as well. And then, of course, the use of the Johnson & Johnson one-shot treatment is out there as well. We hope those things will happen as well. But we're going to make the effort to reach out to young people, but we're not forgetting all of the remaining people, and as Ken pointed out, with homebound individuals, that hopefully will be a helpful part of it. We've just received breaking news. It's the kind of thing that, when you're in the middle of a report, you're just kind of reacting to without really knowing how to process it, that the CDC has come out with some new rules relative to mask wearing and social distancing. We're not in a position, as we're here reporting to you, to be able to tell you how the county's policies are going to change. That's a very broad-based report. And generally speaking, when the CDC comes out with any change in advice, we wait to see how the New York State Department of Health is going to interpret that, because it is the New York State Department of Health's guidance that we as a county health department, as a county government, follow. And you may recall there were times when the CDC announced a change in the the quarantine provisions from one set of dates to another. We saw the change in policy, but we still had to operate with the New York State DOH rules until they came down. I think we all feel that things are moving in a very positive direction, and if what comes out of this is a reduction in mask wearing, we will embrace that. We'll do it responsibly in line of what science is telling us. So for those who may have questions for me, the simple, broad-based answer is we are going to assess what this breaking news is as soon as this report is over, and whatever kind of announcements we have, we will make them to follow. We've already indicated that we intend to open our pools on Memorial Day weekend. We intend to, our beaches on Memorial Day weekend, our two beaches, Playland and Croton Point Park, on Memorial Day weekend. And then in June, we intend to open our 4 pools and Playland Park as well. And we will evaluate what are the criteria for how many people and how they're going to operate in light of whatever these new recommendations are. But we're not in a position to know exactly how to respond to them. We're going to talk to our professionals in our various departments and make some decisions. If, in fact, this breaking news allows us greater flexibility, we embrace it. Ever since the beginning of the pandemic, we have tried to show flexibility in keeping things open where we thought we could do it responsibly. And it seems like ancient history now, but we had a big debate over keeping golf courses open when this all began, and we made the decision to do so, and it turned out to be the right decision. We made the right decision on Bicycle Sunday a year ago. Now we're in the second year of Bicycle Sunday. And, we take no particular victory lap. We're just trying to do what we think is practical. And if the new CDC guidelines, if adopted by the New York State Department of Health, reach us, in short order, we will start making adjustments accordingly in every element of county operation, the number of people coming into the offices, how we interact with people, and how we handle our recreational facilities. All of that is yet ahead of us. That summarizes the COVID portion of the update. I just wanted to give a brief update in anticipation of a week from today, a week from tonight specifically, where I'll be giving my annual State of the County message. This will be my 4th county message as county executive. It is scheduled for Thursday, May 20th at 7 p.m. I will physically be in the chambers of the Westchester County Board of Legislators. Members of the board will be present for that, but because of social distancing standards, we will have a very limited crowd of people in the room. Pre-COVID, the room would usually be packed to the gills. And I will deliver, that message to my legislative colleagues here and go over some of the different issues. I do want to highlight that during that report, we're going to touch on our COVID strategies and our responses, summarize what we've done so far up to this point and how we project ahead. We're going to talk a lot about the citizen involvement that we've included in decision makings, whether it's citizen involvement in our reopening task force, how we've restructured our Human Rights Commission, how we use in general boards and commissions, sort of our bipartisan strategy to appointing people to serve on these boards and commissions. Both Republicans and Democrats have been appointed to key positions as we try to include everybody in Westchester to the greatest extent possible in our decision making. We'll talk about our environmental initiatives. You saw just earlier this week our effort made to make a firm commitment to convert our fleet of automobiles from gasoline power to electric. Made that commitment alongside the Suffolk County Executive Steve Malone. We're going to talk about the key appointments we've made to positions of responsibility in this government, how we have sought out and achieved diversity between those of different genders, those of different ages and demographics, so that we have a diverse group of people as commissioners of departments, and more than just commissioners in positions of authority, decision-making authority, which include directors of program and policy, deputy commissioners, departmental component heads, people who run some of our agencies that aren't as large necessarily as a normal department, but are very impactful in public policy creation. And all of that we think is important. We're going to cover our capital projects. We've made a significant effort in the county to try to fix the things that we found broken when we walked in the door. And I think we've had some success. We just toured today. We'll talk more about it in the days to come. The site that will be our new New Rochelle Family Court, it looks terrific. This was an issue that was batted around for 6.5 years with no resolution. Well, not only do we have resolution, we have a brand new family court. And as you follow, the Sturm und Drang in whatever medium that you choose to get your news from, you will see from time to time specific issues that pop up and they become sort of the cause célèbre of the moment. But we're going to make the point that you need to look at the totality of the work of this administration across a host of different public policy areas and how much progress has been made in each of those different areas. Some of those progress are physical improvements that you can see and touch, like the Sprain Ridge Pools and the Miller House Washington headquarters and the North County Trailway. Some of it is in terms of public policy, for which we share with the Board of Legislators things like the wage theft law and earned sick leave law and the LGBTQ conversion therapy ban, raising the age of tobacco, and a host of laws that we passed in Westchester, which were later supported by state laws that passed and overrode the things that we had done, where we embraced what we thought were reasonable mandates that came from the state of New York, and we took the initiative to tackle those things. The single biggest thing we're going to report on is the financial picture of the county, and that's what everybody, sort of focuses on, and particularly if you're a homeowner or a taxpayer. And we're going to dive deeper than just what our tax rate is. Many times in my career in public office, and I've been in a number of different years, a number of different positions, a person will say to me, "What's going to happen to my taxes?" And when I answer that question, they drop all interest in government. Their interest in government is simply, what am I going to have to pay? Because either I don't really know what the government does, or I don't really think I use the services of government. And it may be true, you don't go to the county jail. It might be true that you don't fly out of the airport for your lifestyle. But it is true that every day you most likely interact with the sewer system. You don't think of it that way, or you drive on a road and it turns out to be a major road that the county has, like the Bronx River Parkway, or as I do every day, I'm on Playland Parkway, which is a county-owned road that connects me to the rest of the world as I drive around. But we're going to talk about our fiscal policies because it is important to understand that we have prioritized our fiscal policies even as we have prioritized the policies that we have to rebuild the infrastructure of this county, to provide progressive legislation, and to provide aid to the municipal governments. And the way we have gone about doing this is not with a lot of fanfare. We are not out there having parades every day to highlight the things that we've done, but we've tried to be very practical and very matter of fact. I often say how both Ken Jenkins and myself chair the County Board of Legislators, how that informs the way we operate in our decision making. And Ken has a line that he's used that we're recovering legislators in these executive roles. But there's something else important. Ken Jenkins was a corporate executive with Apple, with Arthur Andersen, the consulting portion of what's a major accounting firm. I served for subsidiaries of ITT and Nestle. That's what I did for a living. That's what Ken did for a living. So when you look at our public resumes, and we were in this job and ran for office here and there, that's part of who we are. Part of what manages this budget are senior management decisions that are worked through people like Larry Sowell and Gideon Grant in the budget department, Anne Marie Berger, the finance department, people all throughout this government who are professionals at what they do, so that we can have some announcements for you that we think are going to be very positive. We're looking at a forecast. A forecast is not an actual final number because we're only 5 months into the year. There's plenty of year left, and no one really knows what's going to happen to the pandemic or any other surprises that could happen. But we're forecasting an increase in our general fund balance for the 2021 fiscal year. What is the fund balance? That is our savings account. When you sit across the dining room table with your spouse, or you talk about how your finances, how much money do we have saved? What do we have in the bank for the rainy day or for whatever other needs that come up? The higher that number is in your bank account, the more secure you are, stable, financial. The smaller that number is, the more in jeopardy you are being subject to a surprise expense. Something happens to your car, something happens to your house, and you don't have the resources to pay for it. The same is true of the county. The fund balance represents our ability to tap into resources if we need them in case of a crisis. And during this pandemic, through lots of different decisions, large and small, which I'll outline next week, we're able to increase that fund balance over the prior year. We think that number, it could well be over $200 million by the end of 2021, which will be the largest that we've had in the county's history. Now, you don't go raiding your savings account for every little want and wish. When I was a little kid, I tried to do that to my mom and dad. Gee, I need a new bike. And they'd look at me like they may have had a few $100 saved and their son wanted a new bike. But you don't automatically do that. So what we want to do, we promised to do this in the beginning of our effort, to put this county on firm financial footing, not just lower taxes, which satisfies your immediate need, but also at the same time to have a fiscal stability that when the bond rating agencies look at it, they can say Westchester County, AAA bond rating county that lost that AAA bond rating, well, these folks are trying to get it back. They're trying to be the AAA quality situation. And there are a lot of vague reasons out there for bond rating agencies to make the decisions they make, but they make it on fiscal policy decisions. How do we operate? Do we pay off our debt? Do we bond for certain expenses, or do we pay as we go? And when you pay as you go, you have a greater credibility in the minds of the financial community. So we're going to talk about that next week. And with the projections, assuming that we can continue to show that we're showing growth in our sales tax revenue over what was projected, we're showing a very strong real estate market, and those things are very positive. And we also reduced the workforce, and we did it voluntarily. We didn't do it with layoffs and furloughs that destabilized the workforce. We did it voluntarily. We did it with an incentive program and plan. We did it with working with the labor unions representing these groups, and we were able to reduce the workforce, reduce the cost of labor, and do it cooperatively. It may seem to you like a miracle, but that's exactly what we did in our business years. And all we do is apply those principles here. Sometimes it seems counterintuitive because you know I'm a Democrat, but this is just good, practical-minded business application of principles to the way we run the government. And we're going to talk about that in some great depth next year. We're also going to next week. We're also going to talk about some of the challenges that came out of the pandemic, food insecurity, many more people needing food services because of unemployment circumstances, small businesses that needed a helping hand, and by which we've identified certain programs that we were able to create at the county level. Now, the federal government and the state government have much more resources than the county does, and they have been now most recently, with the Biden administration and with the work in the state, they've made money available for businesses. There was money available last year through the Coronavirus CARES Act and through other programs. But we, the county, too, have not just sat on the sidelines and let other things happen. We've tried to step forward. We'll talk about that next week so you get an idea of how all of those things go into place. So it is true that cutting property taxes 2 years in a row, we hope we can do it a third year. We don't make commitments until we know that we can honor them. And if we reach the point where we can make that statement and mean it, we will do that. And if we can't, we'll have reasons why we can't. But when we talk about growing the fund balance, cutting property taxes, delivering on capital improvements that are necessary, managing our way through an incredible, once-in-our-lifetime pandemic, creating a strong relationship with our municipal governments. You've seen the mayors and the supervisors come right across this podium, and every one of them, Republican or Democrat, we're working together. And again, we're not having a parade every day, how great we are. We don't think in those terms. We think in terms of how do we do the job as well as we can and as effectively as we can. So we'll talk about that next week. We know that talking about government is not for everybody. I'm sure we'll be put up in programming against a Yankees game and a Mets game. I'm sure there's some sitcoms that you watch every week, and that'll be on at the same time, the state of the county. And maybe your kids are playing in the backyard, and maybe you're better off watching your kids play in the backyard. But we're going to report to you next week, fourth opportunity to give you an update of where we are in this county and how we're trying to manage the county. And then, of course, ultimately, this is a democracy. No matter how many bumps and bruises we have, we are subject to the will of the people. And then you, as part of that great population, you'll decide exactly how well you think this place has been managed or not managed, and we'll go forward. With that, we'll go to questions. Catherine Chaffee, our Director of Communications.
Yep, we have one question from Deborah from the Larchmont Loop, She asks you, there is quite a disparity between the numbers of those vaccinated in neighboring communities such as Larchmont and Mamaroneck. Mamaroneck continues to lag about 20% behind Larchmont. Can you provide a comment on why this trend continues?
Well, I think, Deborah from the Larchmont Loop, you also have to remember that when we say Mamaroneck, and now we get into the weeds here, there's the village of Mamaroneck and the town of Mamaroneck. And for those of you who don't live in this area, it's a bit confusing. The town of Mamaroneck outside of the two villages is a third and separate distinct entity from the two villages themselves. So I'm going to presume, Deborah, that the numbers that you're referring to are Mamaroneck Village and Mamaroneck Town and Larchmont as three entities, not two. I think you have to start with demographics. The demographics oftentimes give us the greatest challenges. The older the population in a community, the more difficulty we've had reaching them. Many seniors live alone, aren't reachable through conventional communications, so we'll have a certain amount of those individuals that may not be vaccinated. And the same would be true on the lower end of the scale. It's been available for a while to be over the age of 16 or 18 and be vaccinated. We may be lacking that in a particular community. So I'd look at the demographics by age. I'd look at the demographics by ethnicity and diversity. We have had more of a challenge to reach out to our Spanish-speaking community and to reach them in a way that we communicate this information with them in a way that they feel comfortable with, culturally acceptable, that they can understand. And you have differences between Larchmont Village and Mamaroneck Village in that demographic number of Spanish-speaking people. So I think that could be a factor that explains this. We have had a couple of pop-ups in Mamaroneck Village to try to compensate for what we think is an availability gap. We have not had, as a county, a vaccination pop-up in Larchmont Village, but the local pharmacies in Larchmont Village have been given allocations and have done a very good job of getting out to the Larchmont community. So we'll look into those numbers and determine if there was disproportionately more pharmacies that had the availability in one community versus the other, so we try to break it down. The one thing I would tell you is this, though, and I understand we all think in those terms, and I do too. I personally represented Larchmont, Mamaroneck Town, and Mamaroneck Village as the communities immediately after my home of Rise City, where I served in the city council. The first position I ran for after city council included Larchmont and the Mamaronecks. It's almost 30 years ago this year. We are a mobile society. We go up and down that Boston Post Road and we cross dotted lines that most people don't even think in terms of. You think of Larchmont because there's a train station and there's a library that's got the name Larchmont on it, and then at some point in time you cross some imaginary dotted line and you're in Mamaroneck because there's a train station and a library that has the name Mamaroneck on it. But we're a mobile society. So when we look at numbers, we try to look at them countywide. Now it may be that mobility between Peekskill and Pelham isn't that frequent. But when I look at Pelham, New Rochelle, Mount Vernon, and Larchmont, communities that are relatively close to each other, I look at the demographic breakdowns more than I look at the pure geographic breakdowns. If you live in Mamaroneck Town, in the area that's, north of Myrtle Boulevard, from that point north, you really don't know where Mamaroneck Town ends, Scarsdale, or the north end of New Rochelle begins. They look the same as suburban communities. If you know where the dotted line is, you know when you're crossing it. But absent that, I look more for what are the demographic differences and how do we customize our efforts to reach people who haven't been vaccinated based on those demographic reasons, the age cohort, perhaps the multifamily occupancy of which you have more of in a Mamaroneck Village and parts of Larchmont than you do in other parts of the community. So that's really, Deborah, what we're trying to focus on. How do we identify and reach the people that we haven't vaccinated yet? And that's really what our task is. And hopefully we'll do it a little bit better each passing week. You'll see the numbers come up everywhere. At some point you will see some differences. Certainly the more urbanized areas, the Yonkers and the Mount Vernons of the world, have a more difficult challenge given the nature of what they have to deal with demographically and the size and scope of those communities. But I think that the efforts we make in Larchmont and Mamaroneck, and by extension everywhere in this county, if you're watching in the Briarcliff Manor, Ossining Village, town outside Ossining area, if you're talking about a river town, well, which river town? Dobbs Ferry, Tarrytown, Irvington, Hastings. When you're up in the northeastern part of the county, the North Salem or the South Salem section of Lewisboro, which goes all the way down to Vista, all of those little geographic differences, we try to figure out how do we best reach all of them. Because at the end of the day, we're not going to be happy until we can get all of us as a county up to a certain number. Any other questions? Very good. Well, thank you for watching. We will be together again next Monday at 2 o'clock for the standard COVID update. We're going to be having other press announcements as appropriate over the course of the week. We'll do another COVID update a week from today. And then, of course, the aforementioned State of the County message will come at 7 o'clock a week from tonight. You may remember the last time we did one was in October. We had to postpone last spring's State of the County message because of the COVID outbreak. We postponed it to October. Then even at the very last minute, we had to postpone it because there was an exposure to COVID that we all had from one of our friends in the county legislature. Everybody worked out fine at the end, but wisdom was postpone the speech again. So we hope we don't have to postpone it. We'll give you the address. You'll be able to take whatever measure out of it that you'd like, and then we'll have a chance to go forward. I'm George Latimer, Westchester County Executive. Thanks for watching. Have a good week, good weekend, and stay safe, and hopefully we'll see you Monday, 2 o'clock.